Welcome, everyone. My name is Sierra Sanchez, webinar producer with CGLR. The webinar will begin at the top of the hour and will be recorded. We encourage you to connect with the Campaign for Grade Level Reading on social media. On Facebook, like the page Campaign for GLR. On Twitter, follow the account at Reading by Third. And on LinkedIn, subscribe to us at Campaign for GLR. Please use the hashtag Learning Tuesdays and tag us to tweet anything you learn from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. Once again, we would love to connect, so follow those pages you see listed on the screen, and we'll begin shortly. Okay, welcome again, everyone. As I said, my name is Sierra, and I will be behind the scenes helping to produce this conversation. I have just a few housekeeping details before we get started. First, we would love for you to introduce yourself, so please use the chat box at the bottom of your screen to share your name, city or state, and your organization. Be sure when responding to select both panelists and attendees so that we all know who is here. The webinar is being recorded and live streamed on Facebook. A link to the recording, as well as any resources, slides, and bios, will be shared in a follow-up email to all who registered. And finally, we'll be posting a brief on-screen evaluation during closing and highly encourage you to respond. This helps us with our commitment to continuous improvement. And before we begin, I wanted to turn your attention to our upcoming GLR Learning Tuesdays webinars. Next week on September 19th, we'll have an exciting doubleheader. First, a peer exchange learning conversation on what happens or doesn't happen in one generation affects the next. 2-gen strategies for alleviating poverty, high quality early childhood education. This will be co-sponsored by United Way Worldwide and Ascend at the Aspen Institute, and it will start at 1 p.m. Eastern Time instead of the normal 12:30. Then at 3 o'clock that same day, we'll have a session on new data indicating stalled progress in learning recovery and some bright spots. On the 26th, we'll have an exciting funder-to-funder conversation in the 12:30 slot, looking at initiatives in Flint, Michigan. Registration information will be posted in the chat box now, and we hope you can join us. Joining you now is Hattie Miles-Polka, Senior Consultant with the Campaign for Grade Level Reading. Thank you and enjoy the webinar.
Thank you, Sierra. Hello, everyone. Thank you for joining us for today's webinar, The Urgent Need for Effective Childcare and Early Childhood Education Policy, which is graciously co-sponsored by Early Learning Nation magazine. I wanted to reflect a little bit about some of our past GLR Learning Tuesdays webinars on childcare and early childhood education. We have discussed advocacy efforts to make the case for the importance of caregiving, including child and elder care, and successful local campaigns in New Orleans, Kent County, and New Mexico. We've talked about the urgent need to raise wages for early childhood professionals, how to strengthen the business model behind the childcare sector, among other topics. But today's conversation comes at a time of great urgency, given the child care funding cliff approaching at the end of this month. Pandemic funding has helped to a degree, but without a nationwide system to address the many issues facing the early childhood workforce, as well as the need for early childhood care and education, this problem will continue to catalyze and grow. We have a panel of experts with us today, each one of whom brings a different perspective to the table as we discuss attempts to address this crisis that have been attempted in the past and what needs to happen going forward to make real, tangible change. I'd like to now introduce each speaker before we jump into the conversation. And as a reminder, speaker bios will be shared in the chat shortly. Today, we are joined by Elliot Haspel, who is the Director of Climate and Young Children at Capita, Lisa Roy, the Executive Director of Colorado's Department of Early Childhood, as well as Jessica Sager, who is both co-founder and CEO of All Our Kin. We also have Stephanie Schmidt, the Director of Childcare and Early Education at the Center for Law and Social Policy, Katharine Stevens, who is the founder and CEO of the Center on Child and Family Policy, and Laura Valle Gutierrez, who serves as fellow at the Century Foundation. I'm happy to welcome each of our speakers and for all of us to hear their words today. I'd now like to welcome on screen our moderator, Michelle Kang, who is CEO of the National Association for the Education of Young Children. Thank you, Michelle, for joining us.
Thank you, Hattie, and thank you to the Campaign for Grade Level Reading for sponsoring today's conversation, as well as Early Learning Nation. I am glad that all of you are joining us today and thankful to be here representing NACE and our 60,000 members and 51 affiliates. I'm proud that our members represent educators working in all states and across settings, including family childcare centers, Head Start, faith-based programs, and military programs. We center the voices and experience of educators, and I look forward to bringing the experiences they share with us to this conversation here today as we ground the urgent need for effective childcare and early childhood education policy, specifically in the experiences of the work of educators, of families, and children across states and communities. So to that end, I want to give a shout out today to any educators and providers on the webinar, and especially our NACE members, and encourage you to join in the chat and share your thoughts as well. None of us could do this work without you, and I would be remiss if I did not thank you both for what you have done in the context of elevating your experiences and what you continue to do to support young children, families, and communities, particularly relevant in the policy context. So before we get started with our impressive group of panelists, let me take a moment to highlight how we got here. As you all know, the reality is that childcare was in crisis before the pandemic, a crisis created by decades of public underinvestment and structural inequities. The flaws in America's childcare market have created an entirely untenable business model. For programs, this often translates into near poverty wages for early educators and for families. This means unaffordable cost of care. While the pandemic made apparent the essential nature of childcare in supporting children's positive growth and development, in supporting families' working lives, and in driving our local and national economies, it also weakened the already fragile foundation, leading to staffing shortages that have worsened as educators leave the field, often due to still low compensation, other more viable economic options, and insufficient support. With historic federal relief funding, many providers managed to avert closures and loss of staff as they use funds to stay open and support educators and families as best they can. And we'll talk more about relief and what it's meant to programs, families, and educators later on today. Building on the successes of relief funding, last year we were on the cusp of a monumental federal investment into early childhood that would have transformed our systems of childcare and early learning. This funding, established through the House-passed Build Back Better Act, was ultimately not included in the Pared Down Inflation Reduction Act that was eventually signed into law. NACE, along with many partners and hundreds of thousands of advocates, educators, and families, were, to put it mildly, deeply disappointed. And we'll talk more about the reflections and lessons from that time in just a few moments. But as we turn towards that conversation, I'll note finally that we entered today's discussion also without continued funding to sustain childcare stabilization grants, something that was referenced earlier, which officially expire at the end of this month. When NACE surveyed providers last year about the impact of the grants and their looming end, they expressed deep gratitude for what the grants did, along with deep anxiety about what would happen to their programs with their expiration. And unfortunately, we are already seeing their anxieties play out in real time as states exhaust their remaining funds, programs and classrooms closing, having to raise tuitions, and losing staff. Practically speaking, this is layering on even more challenging factors on top of the stress of programs having to turn away parents who have needs, and we only expect these problems to get worse in the coming months. As we've all said for many years now, it is time to solve childcare, and we have a great panel of experts with me to discuss exactly how we go about doing just that. So please welcome our first two panelists, Elliot Haspel and Katharine Stevens. Welcome, Elliot and Katharine. The Build Back Better plan, which I've just briefly mentioned, was groundbreaking in terms of the scope and scale with which it addressed the major pillars of the childcare crisis, including affordability, accessibility, quality, and workforce compensation. But as we know, these issues are complex and challenging, and of course, trade-offs and compromises had to be made throughout the process. And at the end of the day, I'd love to hear from your different perspectives, what did you see as some of the highlights of this plan? Elliot, let's begin with you.
Sure. Thanks so much, Michelle, and thanks to everyone for being here. I'm excited to be talking about this. I think looking back is also very important because, as we know, a lot of the pieces within Build Back Better are continue to be in proposals that are moving forward. And so I think it's important that we use this moment, particularly with a gridlocked Congress, to really hash out, what happened and what's the ideal policy moving forward. I think to put a really fine kind of philosophical point before I go into the actual proposals themselves, you talked about all of the trend lines that were happening in the childcare system before the pandemic even hit. And since the pandemic hit, I think it's really important to note that the impact on families and the overall country are also really significant. We have families that now lack the freedom to live in and invest in the communities that they want to live in. You can find articles of families moving away from rural areas into urban areas, moving away from urban areas into suburban areas, giving up on communities, their faith communities, their neighborhoods, not because they want to, but because of lack of childcare. We have families that are not able to have the care situations that they want to have. They're not able to parent the way they want to parent. They're not able to have the time they want with their kids, again, because of the childcare situations. And we even have families in this country who are not having children that they want to have for no other reason than a lack of affordable and accessible childcare. And this pain point goes far beyond just the lowest income Americans. It is hitting middle-class Americans, upper middle-class Americans. There's almost no income bracket that is unaffected. And, within this country, we have at times said there are these essential services that regardless of whether or not someone technically could pay, we are going to provide them. The government is going to roll up tax dollars and we're going to make sure that they're accessible to everyone. And public schools, fire departments, libraries, roads. And so there's this question about, does childcare fit in that category? And that is the context, I think, on which Build Back Better really came onto the scene. And there are definitely parts of the legislation that I disagree with. And actually, I think you'll find that Katharine and I, who come at this from very different perspectives generally, actually are in alignment on some of those points. And I think what'll be interesting is to talk about, where those are and how we can think about moving forward. To answer your question directly, I think the biggest highlight of the plan was how much money it was finally putting into the system. So childcare is locked by its economic fundamentals, right? You can nibble on the edges with regulation, you can nibble on the edges with some of these economies of scale, but ultimately it's a human intensive service to provide, and it should be a human intensive service to provide. It's gonna be expensive. And so the fact that the Build Back Better would have put in $400 billion over 6 years is really significant. That is saying, here's actually the scale of funding that is required to have an effective system that works for everybody. I was really encouraged to see that there was both a push on supply and on affordability. So sometimes we decouple those things. We just say we're going to make it cheaper for parents, so we don't do anything about the workforce or the supply. Sometimes we say we're going to do some stuff around the workforce and supply and not make it cheaper for parents, less often. But we sometimes decouple those two things. Build Back Better had both. If you were making under 75% of state median income, your child care would have been free. It's actually 85% in the latest version of the Child Care for Working Families Act. And at the same time, there were requirements in there about putting a floor for compensation that no early educator is going to make them make less than a living wage, and that they would be walked towards parity with elementary school teachers. And again, we can talk about some of the details there, but conceptually, the idea that childcare educators should be respected, making a dignified salary and good compensation, good benefits, like that was in there. And additionally, there was dedicated funding for facilities, for starting new programs. Those sorts of things are the kind of elements that we're going to need in any kind of childcare moving forward. So I'll pause there and turn it over to Katharine.
Thanks, Elliot. Katharine, let's turn it over to you now, and let's begin with the positives in this bill from your perspective, though I know you'll share some of your concerns in just a moment.
Sure. Yes. So as Elliot highlighted, Build Back Better very famously did not pass, but this is still highly relevant because Build Back Better is essentially a detailed legislative blueprint for a vision for America's young kids that's still promoted by many as the best approach to federal early childhood policy. So as Elliot emphasized, it really is important that this is the right time to be kind of wrestling with these issues. What I see as the most valuable thing about Build Back Better is that it elevated and tried to address a very real and very serious problem, which I would define as greatly inadequate access to high quality childcare for basically half the children in this country who live in what we would define as low income families. So about half of kids from birth through age 5 live in families making less than $80,000 a year. To me, ensuring that those children, many of whom have parents who have to work for economic survival, is the central priority. Currently, as many of you on this call know, the Child Care and Development Block Grant, CCDBG, is the federal program that is aimed to help these children. It provides subsidies for families earning less than 86% of state median income, which averages about $80,000 a year for a family of 4. But also, as many people on this call know, the acronym is CCDBG, it is falling far short of that goal. Well under 15% of kids who are eligible for that existing program, the 15% of children under age 6 do not, over 85% of eligible children do not receive subsidies because there are not enough funds for those families. For the small percentage, like under 15% of families that do receive them, they're often insufficient to access the kind of high quality providers that more affluent people are already choosing for their children. So that inadequate funding for subsidies also, not only is it depriving millions upon millions of lower income children access to high quality care, it also leads, as Elliot was discussing, to extremely low pay for early childhood workers, below that of almost all US occupation. That obviously hurts those workers. Many of them are on government assistance. And at least as important, it hurts the children they're caring for 3 reasons. The field can't attract enough high quality workers in the first place. Earning poverty level wages obviously causes financial and emotional stress for many workers, which in turn has a very negative effect on the children in their care. And it leads to high turnover, estimated between 25 and 40%, which is especially terrible in childcare because strong, sustained, consistent, nurturing relationships are the key driver of young children's development. So more federal dollars for childcare are essential, and I greatly appreciate the degree to which Build Back Better has really foregrounded that problem. As we'll get to later, I think it took the wrong approach to this really crucial problem, but am glad that it's been so successful in elevating the issue.
Thank you, Katharine. And it sounds like there's a thread here for both you and Elliot, which is recognition of the cost of this quality care, that real money was being put on the table to address a fundamental problem, which affects so many communities and families. And that's, one of the positive I heard from both of you. I'd like to now turn over to some of those areas that you see are trade-offs or drawbacks of the plan. So Elliot, starting with you, what are some of those trade-offs or drawbacks of the Build Back Better plan?
Yeah, so I think Katharine and I agree on this basic point, which is that Build Back Better doesn't support enough pluralism in childcare policy. And by pluralism, what I mean is you should have viable options, accessible, high quality for any kind of care setting that works for a family. And that includes stay-at-home parents, that includes friends, family, neighbor care, that includes family childcare, and that certainly includes center-based care of all types. Build Back Better, those settings also require different policy mechanisms. How you're going to support an FFN caregiver is going to look different than how you're going to support a center-based provider. Build Back Better tended to, in general, privilege center-based care. It's basically silent on stay-at-home parents and FFN care, other than the little bit of existing money that exists for them. It leans very heavily on state quality rating and improvement systems. And those who don't know, I think it's 44 states have them. They're basically tiered systems, sort of evaluation that says, this is level of quality that a program is at. There's been quite a lot of critiques of QRIS over the past several years from multiple corners on basically a couple of grounds. Like one, that they tend to favor programs that look a little bit more like school, so it has a somewhat narrow definition of quality. Two is that the levels actually don't seem to correlate hugely to child outcomes, which is a problem if you're trying to measure quality. And then thirdly, some of the QRS systems rely on various levels of degrees for their educators, and there's still a very live debate about what the degrees and credentials that early educators need. We know they need to be well trained. We know the number one thing we can do is make sure that they're well compensated and they have access to continuous professional development. But much of the framework is built on QRIS. And so that is, I think, a fair criticism. We have to really think about, when we're talking about wanting there to be quality, what are the ways to do that in ways that are really inclusive and that are really pluralistic? There's a tension there that I think we need to wrestle with. I'll say briefly, I don't think that this approach read to me as government overreach, because the fact that the government is funding something doesn't necessarily mean the government has to run something. Medicare is a great example, highly popular program, government funded, lots of choice involved. So there's no reason we can't have both of those things. I think that we need to think about, though, is, again, what is that framework of quality moving forward? And the last thing I'll say is, I have been on record for a while. I don't like this artificial split between childcare and pre-K. If you look at Build Back Better, it had two sort of separate titles within it, and they have very, very different policies. So like pre-K would have been basically free for all of the families. Childcare had a sliding scale. There were different levels of the federal share versus the state share. And in my mind, pre-K is a form of childcare in the way that kind of like, all squares are rectangles, not all rectangles are squares. And so the idea that we would create such a separate policy track for pre-K, when many of those very same pre-K kids, before or after they're in their school year program, are using childcare programs, is a little bit strange to me. And so I would really like to see us moving forward, thinking about a unified, comprehensive birth to 5 system, which ideally extends child care policy up through the school age child care and connects on the back end, or on the early end, to paid leave policy. So I'll pause there.
Great, thank you, Elliot. I want to turn it over to Katharine to come back to you to share some of those thoughts in terms of challenges on the plan. You touched on it a little bit as you were talking about some of the positives, but would you expand on and share more of your thoughts?
Sure. Thank you, Michelle. So I heard many people arguing that Build Back Better just built on the core strengths of CCDBG, kind of continuing that commitment to state flexibility, and if anything, further shoring up its support for parent choice. I recently published a pretty detailed analysis of BBB legislation, which I hope anyone who's interested will look for, in which I showed that BBB was not just a lot more money for CCDBG, which I think we need, but rather laid out an entirely different approach to federal early care and education, which I think would have negatively affected families, children, and providers through both intended, in some cases, but in a lot of cases, unintended consequences. So the first thing is, it really would have greatly increased federal power and decreased state and local control. And according to what my analysis, I think, showed, is that it was in effect centralizing control over much of the whole nation's early care and education in a single federal agency, an HHS, ACF on top of it, and really diminishing state and local leadership and flexibility, which are characteristic of CCDBG. Following what Elliot said, which I completely agree with, it would have enforced this kind of federally defined concept of quality that has little to no demonstrated relationship to child development outcomes, and in many cases inconsistent with how parents, much less children, would define it. It would have diminished parental choice by privileging this federal definition of quality over that of parents. so they would have, so in that way, it would be diminishing parental choice. And in practice, I think it eventually would have, sort of following on what Elliot was referring to, would have eventually put family and faith-based providers out of business just because of the way the legislation was structured, as I explained in the report, which then obviously further reduces the options available to families. Finally, the legislation established a strong new incentive for putting young children in non-parental group care, which I think reflects a misguided view of what many young children and their families want and need. Many families want to raise their own young children, but even as the Build Back Better legislation was emphasizing the crucial role of early care, it was simultaneously diminishing the role of parents in providing it. So overall, the fact that some families need more help paying for high quality early care and education doesn't mean that the federal government should be playing a central role in designing and running it, nor does it mean that our aim should be childcare for all. And in fact, one really negative consequence of this is that many states are not comfortable with that approach. And in fact, the Congressional Budget Office actually projected that well over 1/3 of children under age 6 live in states that would not have participated in one or the other of these two programs, childcare and universal pre-K. 40% for the childcare program and 45% for the pre-K program. That reduced the legislation's total projected cost by billions. But if we're designing federal programs that are not intentionally designed for maximum state participation, we're essentially prioritizing the well-being of young children in some states over others. So I'll stop there as a brief summary of my thoughts.
Thank you, Katharine. And there is so much more that can be said from many of us on this topic. And so in some ways, I feel as the moderator, making sure that we all have the opportunity to share our perspectives. But I will point to the chat because I see that there are resources being placed there, inclusive of a resource that NACE is sharing about the perspectives of educators and programs. Because I'd now like to turn it over. Thank you, Elliot and Katharine. I know you're going to come back on at the end when we have a group discussion about what this means in terms of possibilities. But Stephanie from CLASP, I'd love to invite you to come on camera now. Like NACE and other partners, CLASP played an integral role in advancing and calling for the investments and policies that were outlined in Build Back Better. In the last question, we talked through some perspectives on challenges and highlights, and we heard from Katharine and Elliot. Stephanie, can you give us some insight into the behind the scenes challenges and limitations in the specific context of Congress and the pandemic, and offer some lessons that advocates and policymakers may be able to use going forward?
Yeah, hi, Michelle, and thanks for the question. I'm grateful to be here today, and this is such a rich discussion. I have so much to say. I'll try to stick to the specific question that you asked, but look forward to continuing this conversation even beyond our time together today. I mean, I think the headline for me is that this is really uncharted territory for us. We, as a childcare community, had never navigated a large-scale child care proposal through the reconciliation process. And I know we haven't really talked much about the reconciliation process, but that was the kind of vehicle that Build Back Better was potentially going to move on. And that's a special budgetary procedure which Congress can use to pass legislation with just a simple majority. And so we had a lot of learning to do because of the way that things were coming together and how the timelines kept changing. And it was almost like a build the plane while we're flying it kind of situation. And of course, the reconciliation process has specific rules that are different than those of regular bills, and the process is really different too. So the reconciliation provided a lot of great opportunity to be able to pass with a simple majority, but it also was really challenging to get all the pieces to fit within the confines of the special reconciliation rule, while also learning those rules at the same time as a collective community. And then I think beyond that specific process piece that we were navigating as a group, we also we're kind of dealing with the actual potential reality of a large-scale child care proposal for the first time, the reality being the first time. Of course, we had many bills, large-scale bills from Senator Murray, from Senator Warren, that really were valuable markers and large-scale programs that would be tremendously helpful, but they were never introduced in a moment where they were viable. And so I think for the first time, we were really thinking about, how would this actually work? How would this be implemented in a way that would have the most impact, that would work best for parents and providers? And I think there was a lot of very helpful, feedback loops happening and being created, and new partners coming in and different perspectives being brought into the conversation, which of course is very valuable to get the legislation to a better place. And of course is continuing to serve us as we're thinking about where we go from here and what comes next. And then, of course, the other two challenges are the challenges that are almost always ever present in legislative work, and that's, funding limitations. You heard Elliot highlight that the large money, the big large scale dollars were unprecedented and really exciting, but there wasn't unlimited resources as part of Build Back Better, and that created some limitations within what was possible in terms of getting to that ultimate goal of providing childcare for as many families as possible. And then of course the general political tensions were a challenge as well, with different members having different priorities and different approaches to how they were moving in the process. So I think it's safe to say we learned a lot, and the Build Back Better process really shifted a lot of mindsets for folks and opened the door to thinking in a whole new way about what is possible and what could have the most impact for children and families and providers, to thinking bigger and to helping us get outside the confines of this resource restricted environment that we've always lived in.
Thank you, Stephanie. And I love that highlight of the shifting mindset and thinking big about this, because it is such a big challenge that we have, and to be encouraged in light of the disappointment of what we can take from what was learned to be able to help us continue to press forward, because the problem is still very much here. We could even say that it's been further exacerbated given where we are today. And it's a nice highlight as we think about, where do we go from here? And as we talk about going forward, and we'll get into relief and the crisis more in just a minute, I also want to bring a focus on the major federal childcare program we do have, CCDBG, which Katharine mentioned earlier, and which enjoys broad bipartisan support, but also has been massively underfunded for decades. Can you share more about how CCDBG serves as a foundation for federal childcare investments, and also touch upon the opportunities and the limitations there?
Yeah, sure. Yes, and I'm glad Katharine brought it up already. Of course, CCDBG, as Katharine mentioned, stands for the Child Care and Development Block Grant. It's the primary source of federal funding for childcare in this country. It really is the primary way that families can get help in affording childcare, which obviously we all know is very, very expensive. So it really acts like a lifeline for the families who are able to receive subsidies. It allows parents who need or want to work to attend school and have access to affordable care in a stable environment for their children while they go to work or, pursue school. You mentioned that it was underfunded, and Katharine highlighted this too. And I think this underfunding piece is really significant. CCDBG only reaches 1 in 6 eligible children currently with the amount of funding. And of course, there are far more children beyond those who are eligible who could benefit from the program if there were more resources and a more robust program available. CLASP is working on an analysis right now that looks at access to CCDBG by race and ethnicity, by state, which is an update to an analysis that we've done in the past. And it really underlines this point about lack of access, and also shows that this varies significantly by state, by race, by ethnicity. And, you know, there's many reasons for this, but I'll highlight two. One, of course, the aforementioned lack of resources and the tension that creates in decision-making at the state level, which really leads to a lot of trade-offs, which leads to a lot of inequities in who has access to care, what providers are able to be paid, and much more. And we're seeing this in real time with the numbers coming in on the number of participating providers in the CCDBG program and how that has been changing over the last, 10 plus years. We're seeing that the number is decreasing so significantly every year. So in addition to limited investments for direct services for children, we're also seeing limited investments to ensure that there are providers and supply available for the families who are accessing care. And then also, we have the history and the creation of support programs in this country more broadly, and the narrative of deservingness that comes with that at play in determining who has access to care. So, whether we're willing to admit it or not, many support programs, and childcare is not excluded here, really have roots in, a racist history, resulting in policies and practices that often exclude and marginalize people of color. And this bias has direct impacts on families' access to many programs, including childcare. And these policies and practices have really significant intended and unintended, in some cases, negative consequences for families' ability to, live and survive and have economic well-being and economic success and mental success in this country. And this is particularly challenging for Black families who are most likely to be impacted by racism. So really, I think two sides to the CCDBG story here. One, an absolutely necessary support for families, and a lot that can, on the other side, a lot that can be improved upon to make care more accessible and equitable and reach far more families. And of course, a lot of that is driven by the historic lack of investment in the program. And a lot of it was, from my perspective, addressed in Build Back Better in terms of making care more equitable and accessible and affordable, and really valuing childcare providers in a better way.
Thank you, Stephanie. And I will say, I'm going to say that the comments you shared really put a fine point on the word underfunded. You mentioned 1 in 6 eligible children, and that's eligible children. And that doesn't even speak to like the broader audience of the possibilities. And going back to the very first thing, which is around Build Back Better, we're talking about funds that are needed to be invested in order for us to make the difference in ensuring that care is available and affordable, and educators are supported. Thank you so much, Stephanie. I really appreciate your comments. And I know you'll come back on at the end of our conversation to talk about some of the wrap up. I'd like to now turn to talking about the urgency of this issue. And with that, invite Lisa Roy, Jessica Zager, and Laura Valle Gutierrez to come on video as we pivot to talking more about how important this issue is for now and why we need to be talking about and elevating the realities. So Laura, our earlier panelists have spoken already about the childcare crisis we're facing and what's needed to solve it. You have spoken and written extensively about these issues as well. Early this year, you spoke at a Women's Democratic Caucus shadow hearing, joining one of NACCE's educator members, and your final remarks were quite powerful. You stated, the stakes are high, 70,000 childcare programs, 200,000 early education jobs, 3 million children and their parents, and nearly 11 billion in state economic revenue. When America decides something is a priority, we find the funding. It's time to prioritize childcare to ensure all our families are able to thrive. Laura, could you elaborate more on this stark reality and speak a bit to what relief has meant for states, programs, businesses, educators, families, and children? And further, who is likely to suffer most disproportionately as a result of this looming funding cliff?
Yeah, definitely. Thank you, Michelle, and everyone for joining us today. I think to start, it's worth reiterating what you said in your opening remarks and what many others have referenced, which is The problem of high tuition prices for families, low wages for early educators, and decreasing program supply has grown in severity for several decades, but was really pushed to crisis levels by the COVID-19 pandemic, and that the childcare provisions in Build Back Better never passed. So in this crisis moment, back in March 2021, Congress took decisive action by passing the American Rescue Plan Act, which included substantial childcare stabilization grant funding, and it included some other sources of funding that states could use to help childcare providers stay afloat and meet families' need for care during this COVID-19 pandemic, which placed extra pressure on providers in a sector that already operated on razor-thin margins. So these funds were a lifeline, and they expire on September 30th. So what our report really looks at is what's going to happen when these funds go away. We know from providers what a difference they've made. So Carolina Reyes, who is the owner and director of Arco Iris Bilingual Children's Center in Maryland, she received ARPA stabilization funds and said, quote, "I can say this with certainty. I would have closed without support. Even with help, I know even more is needed because we do not have the financial security to keep fighting through this without additional help," end quote. So we know stabilization grants helped providers. Providers use them to cover operating costs during a time of higher expenses and decreased revenue. They offered their workers bonus pay in order to recruit and retain staff. They used these payments to cover mortgage payments or utilities, and even to buy personal protective equipment because COVID was still spreading. So these funds going away are going to have widespread effects. But to your question, the first people that will feel the cliff are those that have already been anxious about it. It's going to be providers who feel it first. Childcare programs might have to raise rates in order to try to stay open. They will maybe reduce classroom sizes to try to operate with fewer students or children, but be able to sort of keep their classrooms open. You know, a NACE survey actually said that 43% of centers expect that they will have to raise rates when these stabilization grants end. And we've already heard stories of providers emptying out their savings account or taking on credit card debt to try to stay open during the height of the pandemic. And many are not willing to do this again. I'll also mention we have a worker shortage in the childcare industry. We're still 40,000 jobs short from pre-pandemic levels. So even if families, some of these, you know, middle income, higher income families are able to pay these higher rates, it's unlikely that it will be enough to raise provider wages to the point where they are able to continue afford to work in the childcare industry. So at the end of the day, as has been said, we have a broken economic model that has been limping along. It was bolstered, like many other industries. Like the airline industry, like the restaurant industry and other sectors, federal investments helped support this funding, but these funds came with an expiration date. And unlike these other sectors, the math didn't add up before the pandemic, and it won't add up now. So you mentioned the top lines. I think they really speak for themselves. We project that 3.2 million children could lose their childcare. This is going to impact families, communities, and their state's economic activity when parents have to leave their jobs or reduce their working hours because they don't have childcare options. And at the end of the day, we know that this cliff is mostly going to be felt by women, women of color who are predominantly our childcare workers. It might come at the expense of families' mental health or their economic security, and both. And just to wrap up, I think really what we think this comes down to is that families across all income levels want their children to have safe and nurturing care, and parents need the freedom to afford childcare and have the peace of mind that their children are going to be safe. So, as I said in my remarks to the Democratic Women's Caucus, it's really time for the United States to prioritize childcare.
So much, Laura. I want to emphasize something that you mentioned, which is something that I've seen too, and I have had the opportunity to visit with programs, which is the empty classrooms. The empty classrooms because there are not staff to be able to provide care, not because there aren't parents and families who are clamoring for and need that care, but because there are no teachers and educators to be able to provide that care, and the pain of the provider who are contemplating the fact that they will feel like they have no choice but to adjust the increase to rates because they will no longer have the support that is needed to be able to keep those rates at the levels that they have. So those are realities certainly that I have heard when I have visited with programs. And I thank you so much for sharing and elaborating on the realities. I'd like to now move over to Jessica because we have talked about how this is impacting not just one kind of provider, it is impacting all providers. And family childcare is among those providers and settings that have been impacted through the pandemic, and has also, we've seen some of the positives of the benefits and impacts of the stabilization grants. NACE and the National Association for Family Childcare, NAFCC, created a brief earlier this summer where we talked about and were able to share the benefits and impacts of those grants in family childcare. Jessica, you spend so much time on the ground with family childcare providers in your work with All Our Kin. What are you seeing as we approach the September 30th and that date, the looming date, and look to the months and years ahead?
Yeah, thank you so much, Michelle. And thank you for including family childcare in this conversation. For those who don't know, family childcare is a critically important source of care. Family childcare is a small program, typically operated in someone's home, providing care to infants and toddlers in the community, to families working evenings and weekends, to families with all kinds of barriers to accessing care, and really to a whole neighborhood. And to Elliot's point around community, every family childcare program is a community hub that is an essential source of care. So one program makes a tremendous difference in a neighborhood. We at All Our Kin work with about 1,000 family childcare educators across New York City and Connecticut, and through our training partnerships, thousands of family childcare educators across the nation. We saw before COVID how very difficult it was for educators to continue providing care to the children and families who needed them. When the pandemic hit, the effects were devastating, but would have been so much more so without stabilization funding. Stabilization funds enabled family childcare educators to pay their rent, to pay their mortgages, to keep the lights on, to pay staff. And they then in turn were able to keep their programs open for children and families, which they have continued to do to this day. With the cliff looming, family childcare educators are really worried, and so are the children and families in their care. What we are hearing from educators is this: for a moment during the pandemic, we were seen and recognized as essential workers. And now conditions have not essentially changed. And yet the funding that made it possible for us to do this work is going away. It feels like we and the children and families in our care have been abandoned. The result is that programs are going to close because family childcare educators are typically not in a position to raise their rates because families that they are serving cannot pay. That is going to be a huge loss. As I said at the beginning, every family childcare program is a community resource. It's a hub. Sometimes it served generations of families. And when that program is gone, it is going to take decades to replace it. So the harm that we are doing to children, families, the economy in both the short term and the long term really cannot be overstated.
Jessica, you all have really sounded the alarm on the importance of family childcare, but the decline of family childcare, and also its importance to the childcare ecosystem. We talked earlier about Build Back Better and its inclusion of family childcare, but what are the specific needs that you think federal and state policymakers need to address to reverse the decline and support family childcare as an integral part of the early childhood education system?
Yeah, so great question. So first, I think we need to reimagine our childcare system. You heard that earlier in this call. I am sure you will hear it later in this call. For far too long, we have expected our childcare system to be subsidized by the foregone earnings of childcare educators. That's especially true in family childcare, but it's true across the system. Rather than put in money, we impose economic hardships on educators who did this work out of love. That's not viable in the long term. It's not sustainable. And frankly, it's neither moral nor ethical for us as a nation to do so. We need to fully fund the system so that parents can afford childcare and so that educators can be fairly compensated for their important work. That's number one. Number two, Elliot referenced this earlier, we need an inclusive childcare ecosystem that recognizes that everywhere that children are, they are, can be, and should be safe, loved, and learning. And that means designing a childcare system where we have funding for every childcare setting, where we recognize that quality is not determined by the size of a classroom or the kinds of desks that you have in it, but by the nurturing, responsive interactions that adults and children are having in the space, and where we are creating funding and learning opportunities that are open to and value all childcare educators.
Thank you. It's compelling to hear about, again, the settings that different childcare happens, and family childcare has been an important part of the ecosystem. And during the pandemic, perhaps had the opportunity to be elevated, and the importance of the stabilization grants making a difference in family childcare providers also keeping their doors open and serving families cannot be missed as we think about the end of this month. Now I'd like to move over to Lisa. Thank you so much, Jessica. Lisa, the establishment of Colorado's Department of Early Childhood Education speaks to the recognition of the need for more widespread support for children and families, as well as early childhood professionals. Can you talk about the impact that federal pandemic funding has had on the early childhood sector in Colorado?
Thank you, Michelle, and good afternoon, everyone. Thank you for having me, and thank you for this particular question. The timing of this webinar is actually uncanny. I just attended a meeting of state leaders. I know you were there also, Michelle, at the Hunt Institute's Summit on Early Childhood Education in Nashville last week. And we were talking with legislators from Colorado, and we're addressing the various issues related to supporting early care and education and our collective early childhood crisis. And there's variation, of course, in how states are working on this transition, I would say, away from the large federal infusion of funding. And despite all the research that proves how beneficial it is to invest in early care and education, I was reminded while at the summit that political will plays a major role in deciding what a state does for children. Only a quarter of our country, for instance, has state-funded universal preschool. And in order to create high quality early childhood systems capable of addressing the complex needs of young children and their families across the country, even in places where state funding might not be politically possible, we have to consider measures that free up resources to support children and families starting at birth. And I heard that quite a bit from our other panelists. We know that some states are looking to expand Medicaid, some are legislating more paid family leave, they're legislating housing policies that benefit families and childcare subsidies for private and public providers. And these are things that states can do that exist outside of the early childhood sector and that are actually a critical part of standing up a strong system. And we're grateful that in Colorado, with all the stimulus funding that we received, that we were able to focus on standing up a new department, launching universal preschool, and bringing all of our comprehensive services that support children birth to 5 and their families into one department. So I think, again, it's key for states in addressing the early childhood crisis to think about creating unified systems that strengthen and better align the child care and the community's goals around available resources. And, something that Colorado did around addressing the early childhood crisis was addressing the economics of it. So you wanted to know specifically how these investments help. We did everything from employee-based childcare to investing in early childhood mental health ensuring that there were bonuses for retaining infant toddler care while expanding our mixed delivery system with early care and education, and specifically our universal preschool program. We support our FFN providers, and for those who would like to become licensed, we have lots of supports for them. So our investments really did go into areas where we could sustain our efforts and increasing quality. And, you know, again, we will see. I do understand what everyone's saying. There is this cliff, and we try to keep families off of a cliff with funding, that they can make enough money, a living wage, to support housing and childcare and their medical expenses and everything. Well, we're in a situation now where states have had this huge infusion of investments, and many of those things will be sustainable because, again, we invested in quality. But the ability to ensure that our providers, all our early childhood professionals, are making a living wage without that continued infusion will be difficult.
Thank you, Lisa. Colorado is doing some great things, and it's wonderful to hear about the ways that Colorado has made investments in addressing the challenges that have been highlighted throughout the course of today's conversation. You mentioned that we were both at a gathering where there were state leaders, bipartisan, from all sides of the aisle, coming together to talk about early education. And there was so much great, rich conversation in that room about ways that states are addressing compensation, they're addressing the supply, they're addressing some of the things that have been highlighted today, because it is complex and it is something that people see are impacting our communities, our businesses, families. So taking a step back from Colorado, what role are you seeing states play in stepping up to address this crisis?
Well, again, we have to be listeners as states. States have advisory groups, councils, but really listening to our stakeholders about their experiences. We learned quite a bit about the pandemic, and there are lots of different issues that came up. I heard the panelists talked about empty classrooms because we can't pay a living wage. We do have to make sure as states that we're looking at innovative ways to support our early childhood professionals with benefits. And I'm talking about benefits in a larger way than just healthcare, retirement. Our group, and I know other tables were talking about things like down payment assistance. But there's a lot of different ways that, again, we can informally support our early childhood professionals in Colorado and across the country. We've invested in higher ed support. So you could take ECE 101 and 103. We expected 900 professionals to take advantage of that. We had over 5,000. Our governor and other governors have talked about the fact that they're offering certificates, associate degrees for free to enhance the ability for folks to get into the profession, to attract them. But we can only retain them with raising the wages to a livable wage and making sure that, again, they have benefits that retain them in this system that we have. The other thing I would say is that besides looking at wages and compensation, lifting up the profession, making sure that people that are in early care and education understand that they are valued. And for those of you who have traveled internationally and gone to a place like Reggio, we want to make sure that anyone who gets into the profession knows that they are honored as teachers of young children, and understand that brain development is one of the most important things that any professional can do in their lives. So we have to make sure, again, that we're paying them.
Lisa, thank you. And I love that you ended on that note of educators being valued for doing work that is brain development. That it can't be missed that the work that is happening by early care and educators in partnership with families is some of the most important and impactful work in our country, which I would gather to say just from looking at some of the chat that there are many people who agree with that sentiment. So we're coming here towards the end, and we'll have a moment hopefully to address some questions. But at this time, I'd like to invite everyone to join us again on video to talk about policy needs moving forward. So to start this final part of the conversation before moving on to audience Q&A with one question that everyone can just take a moment to respond to, and I suspect that there's probably going to be some overlap between us all. What should be the top 2 priorities in childcare and early childhood education policymaking? So I'm going to start from just the top of our panel today with Elliot and Katharine, and I'll just call on folks. So Elliot.
Yeah, thanks. I think the first thing is we have got to find how we get dedicated, robust funding streams. You've heard this throughout. Let's put a fine point on it. This does not work without funding. There's a low ceiling on every other effort. And so we need to figure out how to do that. I think that, along with that, one of the things we didn't talk about Build Back Better did is it established childcare as a right. It would have been an entitlement. And it's a whole different conversation. So stop treating childcare as a public assistance program. Stop treating it as welfare, treating it as something that only this is some fundamental right. It is essential to family flourishing. We start from that first principle, and from a pluralistic standpoint in that first principle, I think we're going to get much further. And I actually think there's going to be a lot more opportunities for bipartisan cooperation.
Great. Thank you, Elliot. Katharine.
Thanks. I think first, we need to be starting with the right policy question in the first place. I don't think the central policy question is how do we provide all children with high quality childcare? I think the right policy question is how do we promote the healthy development of all young children? Across the board, I think we need to be making a bigger effort to put children at the center of our thinking. Gender equality, family income, GDP, those things are all very important. But I think we need to be putting children and advancing the well-being of children at the center of our thinking. Towards those ends, the 2 top priorities I see are first, getting much greater resources to the lower income families for whom the most is at stake, while empowering parents by maximizing parental choice. As I've probably made clear, I think we need to be doing everything we can to help families who must work but don't have access to high quality providers for their children, and those who cannot pay rather than those who would understandably prefer not to. Second, I'd say that we don't have a childcare crisis. We have a crisis in caring for young children. And along those lines, we need to remember that many families want to raise their own young children. And for many young children, the best early learning environment is their own home. So my second top priority is putting families back on the table as themselves crucial and valued providers of what we call childcare.
Thank you, Katharine. Stephanie.
Yeah, I am definitely going to echo those who came before me in sharing that one of the priorities top of mind for me, of course, is money, investments, resources. I think, we need really bold, big, sustainable resources. I think there are so many other priorities that we would all uplift, and all of them require money. And so I think we really need to make sure we have the resources to be able to back all of the changes that we need, and so that we can move out of this world of trade-offs that we just have to live in, where every positive step forward comes with some sort of trade-off on the back end that has negative impacts for children and families and providers. And I think the second thing that I would highlight is the need to change the narrative. I think kind of similar to what Elliot was highlighting about seeing childcare as a right is a story that is one that not everyone believes. And I think in order to, I loved what you said, Jessica, about reimagining childcare, in order to reimagine childcare and make sure it meets the needs of parents and providers and children, we have to be able to tell a different story. We have to change the story of deservingness to make sure that children are all perceived as worthy of care, and that access is not dependent upon, the color of your skin or other factors that shouldn't be considered for someone's ability to have a right to childcare.
Thank you, Stephanie. Laura.
I definitely agree with what's been said. I'm thinking back to what Elliot said in his remarks about taking care of children is a labor-intensive process, and it should be. And I think with that in mind, I have sort of a short-term policy priority that I'm thinking about, which is getting more emergency stabilization funding. Over 100 members of Congress have called for $16 billion in emergency childcare stabilization funding. I think in the short term, that's the top priority. And then in the longer term, I definitely agree, we need to get back on track with the policies that we've long known are needed, robust public support for a comprehensive childcare and early learning system that keeps costs affordable for families, builds up the sector, and ensures that everyone has, the option and freedom to find the childcare that works for them.
Thank you, Laura. Jessica.
Yes, I really want to build on everything that my fellow panelists have said, especially Stephanie. I completely agree with you. And I want to add one more piece to the puzzle, which is we need to move away from a childcare system that essentially pits parents and children against educators. We've created this false dichotomy that either we can make childcare marginally more affordable or we can make educators marginally better paid. And the truth is the interests of both groups are deeply, deeply aligned. Educators can only stay in the field if they're adequately compensated, and they will be able to do better by children if they themselves are thriving. In addition, as I've said, I believe it's really a moral right for us as a nation to compensate educators fairly. And there is huge bipartisan support for this idea. If childcare educators are building brains and hearts and souls, just like kindergarten teachers, surely they should be paid at the same level and have access to benefits. At the same time, it's essential that childcare is affordable for families and that it is accessible and that families can choose the childcare setting of their choice. So those would be my absolute top two priorities.
Jessica and Lisa.
Well, the state of Colorado wants to ensure that every child, family, and early childhood professional is valued, healthy, and thriving. And we do believe in parent choice. And so we have everything from home visitation, as I mentioned, early childhood mental health. We support family resource centers, our early childhood councils, along with licensing, quality, and a universal preschool program. So our mixed delivery system is truly mixed delivery in the sense that if you're a stay-at-home parent, there are resources for you. In fact, I'm at Mile High United Way today and toured the 211 Center, which offers families resources when they call in. So we really believe in a true mixed delivery. So that's a priority. And I mentioned living wages. It's just important that those who work in this field have the ability to retire, to go visit their doctor when they need to be able to take vacation. And so many of our early childhood professionals who are not working in the formalized school system are typically low income And many are women of color and qualify for benefits themselves. So again, our goals around equity and a sustainable, high quality early childhood system, we'd have to ensure that all of our early childhood professionals are making a living wage.
Thank you, Lisa. Before we go to audience Q&A, I just have one more question and follow up to what you all shared. What I heard from a common thread is the current system is not working. We need money. We need significant investments of money to be able to address the challenges that we've outlined, and that workforce compensation is a significant issue that needs to be addressed. And families need options for quality care. And we want families to be able to have that option of the kind of care that best meets their needs in different settings, the mixed delivery system. And honestly, the options for quality care relates to compensation, because there won't be options for families unless there's a workforce to provide those care options. So to go back to the things that you all just shared, from each of your perspectives, what is a key next step to getting one or more of these priorities passed in state and or federal legislation? And I'll start from where we ended. I'll start with you, Lisa, and then go back to all of our panelists. Lisa.
Well, I will say we do need to ensure that the federal government understands how these investments have made an impact. Here in Colorado, we've actually evaluated every single investment that we've made and seen which ones have the largest impacts. We will be presenting that, of course, to the legislature. So we're always thinking about the two-prong approach of what can we do in the state of Colorado as far as state general fund, as far as opportunities for taxes. We did a tobacco tax to support preschool, but even our localities like Denver has a preschool sales tax. And then from the federal level, we want to ensure that our Congress folks and all of our legislators, our senators, know that the investments that they made in Colorado made a difference, and to hear from their constituents. So that's important.
Thank you, Lisa. Jessica.
I think probably the most important thing is that our representatives in federal and state government hear from all the stakeholders who are impacted by childcare. So that means hearing from parents, it means hearing from educators, it means hearing from employers and business people, folks in K through 12, folks in workforce development, plus just all of us here, right? Everyone who cares about the future of our country. I think we need to come together to make it clear that, Elliot wrote this incredibly powerful piece about how support for childcare is sky high, but butter soft. It's time that we tell the government that our support for childcare is not soft anymore. We see this as the make or break issue, and we're going to stand by it. The second thing I would say is that there are no more powerful advocates for childcare than educators and parents, and creating opportunities, training, and forums for educators and parents to make their voices heard and to ensure that our legislators listen, I think should be a top priority for all of us who work in the field.
Thank you, Jessica. Laura.
I am going to be a broken record and say that what we really need right now is to make sure that policymakers, but especially Congress and the White House, are hearing the same stories that we're hearing. We hear every day from every state of providers having to close, and then hundreds of families losing care. We hear from parents having to decide whether or not they should risk economic insecurity and losing out on their health insurance, or try to, find a care option that's maybe a couple towns over. So we're hearing these stories every single day from every single state. And I think it's really important and critical that our policymakers are hearing this and knowing the real live impacts that these funds have, and what is going to be lost if they fail to act.
Thank you, Laura. Stephanie.
I also underline some of what has already been said, especially Jessica's point about making sure that Congress is hearing from everyone. I think just taking that a step further, I think we need to continue to build, a bigger and more diverse advocacy community, bringing in all of the different voices that are present and making them, more able to be heard, but also bringing in new partners to share their experience about why childcare is so important. And I would go even further to say it would be really helpful to, resource those folks, especially the folks who it's harder to, give up time or find the time to be able to participate in advocacy if, they aren't being paid for the work that they're doing. And so I think that that's a really valuable piece of the puzzle. And then I think the last piece that I would add is just making sure that we get our champions, maybe in the broadest sense of the word, those who are, decision makers and policy makers on the Hill, those who are leaders in the communities, those who are leaders in the provider space and the parent space, to really be all in on childcare. I think we just again back to what Jessica said about being butter soft, like Elliot said in his piece, that I think when push comes to shove, childcare is the thing that falls off the table when negotiations start happening, and childcare is the thing that people are willing to let go. And we need to get our champions to, put childcare at the top of the list and have it be the thing that they fight the hardest for.
Thank you, Stephanie. Katharine.
I guess I would say two things. First of all, I think at the federal level, CCDBG is the strongest vehicle for increasing resources to families. It has the best chance of getting bipartisan engagement. As we've been highlighting, CCDBG subsidies, they are currently only reach a small fraction of lower income, or which basically is half the country, working families, and are often insufficient to give those families access to the kinds of providers that more affluent families are already able to use. But that's not a flaw with the program's fundamental design. If the funding were substantially increased so that subsidies could be increased to a level that enable working families to choose and access the early care and education providers they decide are best for their children, and also enable providers and the childcare workforce to be paid fairly. That can all happen through CCDBG. And the second thing I would say, to sound like a broken record, is what we're talking about here is non-parental group care. And the fact is that one of the reasons I think, and this is something would be worth thinking about, Elliot, I'd love to discuss it with you. One reason I think we're perceiving this butter soft is there's been a very small number of surveys that have asked parents not how they feel about paying for childcare, but rather whether they would rather use non-parental group care or raise their own young children. And substantial proportions of families, particularly lower income, lower educated families, have a strong preference for raising their own young children. And that, to me, is something that is essential to put back on the table for what I think our core goal needs to be, which is advancing the well-being of families and young children.
Thank you, Katharine. Elliot.
Yeah, thanks. So, I think that in addition to having these conversations and talking about how you have a next generation childcare policy that does include stay-at-home parents, family childcare, right? That needs to happen. But we do have this immediate moment in front of us where millions of parents are about to see childcare fees raised. We are going to see closures. And so I think I would put a fine point on what many of the people said before. If we're going to stand up, it's more than just having people talk to legislators. It is going to require some muscular, I would say, direct action. And what I mean by that is go and Google Connecticut's A Morning Without Childcare. If you want to go and Google Dublin childcare protests, which were 30,000 people a couple of years ago in the streets of Dublin, like there is a way in which elected officials kind of can discard childcare because there really isn't much of a consequence to them for doing so. They're not, and if you look at what other issue areas do, whether it's in healthcare, whether it's those fighting for gun control, whether it's those fighting for the climate, right? They get loud and they kind of get in their faces. It has to be an inside-outside game. And childcare has not traditionally been great about doing public actions. And so I would encourage us to think about, like, what does it look like to get, like, there are a lot of anxious, scared, frightened, and frustrated parents, educators, advocates, all of us are out there. So let's channel that. Like, this would seem to be a moment to really rise up, obviously in like a peaceful and respectful way, but like to really make ourselves heard more than in the way of just calling legislatures, but truly things that are going to shine a very bright spotlight. Right now, I would say there's more attention on childcare than any time since March 2020. Like, if you look at every major media outlet in this country has written about the childcare cliff. And so now the question is, can we convert that into something that elected officials feel like they have to act? They cannot just let this go again. And so I think that's what I would encourage us to do, is think about what's this next round of direct action is going to look like.
Thank you, Elliot. And I'm now going to turn, this has been such a great conversation with, I'm sure, many thoughts. I see that the chat has been very active throughout this webinar. I want to thank everyone who has joined and been part of this conversation. There are a few questions, and we're going to try to get to just a handful of them, and encourage you to continue to be thinking about this in your circles and thinking about how we are advancing the conversation about the challenges that we've highlighted today and how we can move forward. I'm going to start with a question jumping off of what Elliot, you highlighted. I mean, one of the questions I was asked is compensation and choice are key. How do we hold the government accountable for funding? How do we break this cycle? And Elliot, you touched on Connecticut, you touched on Dublin. I'd love to see if there are a few of my panelists, I'm going to call on you all. This is the part that, as being a moderator, is a little bit fun, is just to be able to see if someone wants to just jump in. I'm going to start actually, Laura, if you want to jump in and give your thoughts on how we might be able to highlight this and break the cycle, and bringing the government accountable, making the government accountable for looking at this and what can we do?
Yeah. So like Elliot said, I think this is a really unique moment where it feels like we have the nation's attention, and I think it's just really important to make sure that these stories are getting out there. So talking to your media, your family, your friends, or your legislators, I think are all critical things to do right now, because we have this potential play for emergency stabilization funding that is very timely.
Right. Any other of my panelists?
Too. Yes. I just think, again, the business community does need to reach out to Congress to let them know the benefits of having high quality early care and education accessible for families. And they benefit from this just as much, if not more, by having a stable workforce. And parents who know that their children are in quality care have the focus that they need to do their work well. So I think that's an important piece of this as well, and that was mentioned earlier.
So can I have one thing real quick?
Yes.
So I talked about the outside game. The inside game is childcare relative to many other issue areas, pretty weak lobbying in terms of funding, in terms of, so if you look again, other kind of the ability to contribute to campaigns for electeds, you attribute to literally have a lobbyist in there with them. And so in as much as people here have connections to donors, right, to help high net worth individuals, to philanthropies who can do more than they think they can do. I worked for a philanthropy, do more than you think you can do in this area. To get them to really be putting money into lobbying, into electoral work, like that's the inside part of the inside-outside game that we don't have on lock yet.
As we head towards a few more questions, I want to highlight a survey that is coming up soon for folks to be able to respond to. Please fill it out as we share additional thoughts from my panelists, but certainly the campaign is interested in hearing feedback from those who have joined today. So thank you in advance for filling out the survey. I want to highlight a question that came up about why the United States does not have universal pre-K, and does it exist in other countries? Elliot, I'm going to tag you for this question since you mentioned Dublin.
Yeah, it does exist in many other countries. So some countries do split out. Again, the younger kids, France is a good example of this. In France, you have creches, which are sort of public childcare centers. You could also get reimbursed, to Catherine's point, for about a third of the costs of having like a nanny or raising your own kid. But then come about age 3, actually as of 2019, it's mandatory, which is controversial. They have maternelle, école, I don't know how to pronounce French, but they basically have pre-Ks that everyone in France goes to. Other nations, like the Nordic nations, you basically have a comprehensive system where you have it's available starting usually around age 1 when their paid leave is out, and then it kind of goes up from there, but they are not split out in the same way. So other countries do have it. The US, I mean, we're behind. That's a much longer discussion, but relative to all the high income nations, we put in second to third least percentage of our GDP into early care and education. So we're just way, way behind on treating childcare as an essential service that helps family flourishing.
Thank you. Any other of my panelists who want to jump in on this question, share some perspective? Okay. I'm going to ask this next question, and Jessica, I'm going to tee you up to see if you might be able to take a first pass at the response. The question was about how do we resolve the capacity, need, and family preference for faith-based childcare entities that want or need state or federal funding, but exclude certain populations from their student, employee, and/or parent groups, specifically LGBTQ community members. And as you're thinking about this, Jessica, and it's a big question, and I also invite other panelists who might want to jump in and think about this. I'll just say from my perspective, faith-based programs are a very important part of the mixed delivery ECE system, and it serves 15% of working families, according to the Bipartisan Policy Center. I was a product of a faith-based program, and I think it's going to be important that we think about how many faith-based programs both accept families that are supported by subsidies and those who only serve families who can pay out of pocket, have successfully engaged in quality and licensing programs implemented by state and external organizations in ways that are non-discriminatory and fully compatible with their faith. And in our experience, we have seen programs that positively assert that they're both rooted in faith and rooted in commitments to health, safety, and quality, and the concepts are not at odds. Jessica, would love to hear if you might comment on this, because certainly we know that many family childcare programs are often connected to a faith-based entity, and would welcome your perspective as well as any other panelists who want to jump in on the question.
Yeah, first, let me say, Michelle, I think your answer was so beautiful and so comprehensive. I'm not sure how much I can add, but I will do my best. I think it is essentially important that we value community-based childcare, and that does very much include faith-based childcare and childcare provided by faith-based organizations. And at the same time, we have to hold the tension around equitable access for children and families. We spoke earlier in this conversation about the fact that 1 in 6 children have access to, 1 in 6 eligible children are able to access the CCDBG subsidy. The truth is that access varies enormously by race, ethnicity, by LGBTQIA status, all these factors. And so, as you say, it is quite possible to have faith-based programs that are also wonderful, inclusive spaces for children and families. And I think the goal for all of us is how to think about how to support that.
Thank you. Any other panelists like to respond to that question? Right.
I would say in Colorado, we've had a long history with CCAP, Head Start, Early Head Start, working with faith-based, and our universal preschool program does as well. So our faith-based programs are not limited in their ability to get any type of funding. Most programs, however, do have non-discriminatory statements that are part of their contracting process. But again, we've been doing that for decades. I've been in early care and education for over 30 years, and my children benefited from child care that was faith-based as well. So that's an important question.
Thank you, Lisa. We have time for one more question. I'm going to tee it up for Stephanie. Who in the House and Senate are the real voices for early childhood education?
Yeah, thanks for that question. I think we're fortunate to be in a place where that list is growing. Thankfully, great, based on all of the great advocacy from, many of the people here and all of the great advocates, parent advocates and providers that we've been talking about today. Just to name a few, of course, on the Senate side, Senator Murray and Senator Warren both have introduced big and bold childcare proposals and are always, willing to stand up. Senator Kaine kind of falls into that same category as well, among others. And then on the House side, I would say some of the big leaders are Representative DeLauro, who is always, willing to advocate for children, Representative Clark, Representative Bonamici. We've been hearing Representative Gomez speak a lot about, his experience and his advocacy for childcare as a result. Representative Scott, of course, with his leadership on previous bills and current bills, and Representative Jacobs too. Again, many more, and the list continues to grow, but those are just a few top of mind right now.
Great. Thank you, Stephanie. Before I turn it back over to Hattie, I want to thank Elliot, Katharine, Stephanie, Laura, Jessica, and Lisa for joining today for today's conversation. I hope that all of you who joined today found it as interesting and thought-provoking as I did. I hope that this compels all of us to continue to take action to elevate the importance of early childhood education in our communities, and look forward to being able to continue the conversation in different venues. And a special shout out and thank you again to our providers and our educators who joined today. Thank you. You are doing the heart of this work. If you're an ECE member, thank you for being part of NACE, and also remiss to be shouting out also to some of our affiliates who joined today. Thank you so much. We are so grateful, again, for those of you who are doing the work day in and day out with families, caring for our youngest learners. We so love you and appreciate you, and appreciate what you do day in and day out in being able to care for children. I'm going to turn it back over to Hattie.
Thank you, Michelle, for moderating this conversation, and thank you to all of our speakers for sharing their perspectives and their expertise. This has been a really important and inspiring conversation. I also wanted to thank all of our attendees for sharing your thoughts and reflections in the chat, as well as many resources in the follow-up. There's going to be a big list of reading for everybody. We'll try to get as much of it in there as we possibly can. Thanks to everybody for attending. And I also wanted to remind you about our upcoming sessions, which you can see on the screen now. And you can also see on our new Learning and Engagement Opportunities website that Sarah Torian linked in the chat. Thanks again to everybody. I hope you have a great rest of your day.